Morning, who was the doyen, the pioneer of diabetes in India, often referred to as the father of diabetology. My wife, Dr. Emma, whose picture is there, along with my spiritual guru, Bhagwan Sri Sathya Sai Baba. We stepped out and started on our own in a rented building in just 2 or 3 rooms in Roypeta High Road with virtually no money, virtually zero bank balance. But God has been very kind to us, and in 6 years' time, we moved. That was on 1st September 1991. On the same date, that is 1st September 1996, we had moved into this 6-storied building, which is our headquarters. So we thought that that was the end of the story, but actually turned out that that was the beginning of the story. Our core value was to provide world-class care for diabetes and its complications at a reasonable cost. Over the years, as we speak, we currently run 33 branches of our center, 16 of which are in Tamil Nadu, 1 in Puducherry, 6 in Karnataka, 2 in Kerala, 4 in Telangana, 1 in Andhra Pradesh, 1 in Odisha, 1 in Delhi, and 1 in Uttar Pradesh. And this has been only possible because of all our students who have qualified and decided to work with us, and also the excellent team that we have at Dr. Mohan's. We have currently 1,159 full-time staff who work with us, 58 consultants, and over 400,000 patients. And the aim is to reach 1 million patients in the next 3 to 4 years. You might ask what makes you special or what makes us special. I don't think anything is special except that we put it all together. So we have outpatient services, inpatient services, eye, foot, dental, heart, radiology, education, physical activity, yoga, pharmacy, operation theatre. The whole thing, when you put it under one roof, then it becomes something special, and that's what we call as total diabetes care. Moving on to the Madras Diabetes Research Foundation. This is a 100% non-profit organization. Again, it started with 1 room, with 1 staff in the year 1996. Today we have 5 facilities: the Clinical Research Unit at Gopalapuram, the Basic Science Research Institute at Siruseri, which is a 6.5-acre campus with 40,000 square feet facility. We have an Epidemiology, Prevention and GDM Research Unit at Lloyds Road. We have a Clinical Trials Unit in Gopalapuram, and a Food and Nutrition Research. We collaborate with various national and international universities. We were recognized by the ICMR, DST and DBT, and recognized by the Madras University, MGR Medical University, and now Deakin University, Melbourne, for doing PhD courses, which means that somebody can work here in Chennai and get a PhD from Melbourne. We have over 1,100 publications, which is a kind of a world record from a single institution, over 710 original articles, 240 editorials, and 150 chapters in textbook. And again, this is all because of the extensive teamwork and the number of people who are involved in research. Over 100 people are involved in full-time research at our center. We have collaborations, and this is only a partial list, with the University of Alabama, University of California, San Diego, the University of Minnesota, Emory, Howard School of Public Health, all these in the United States, with McMaster University at Hamilton, with the Deakin University in Melbourne, the University of Leicester, Warwick and Dundee in UK, Cardiff, and many other institutions. And of course, several national institutes, including the All India Institute of Medical Sciences, with whom we collaborate very heavily. In 2008, we had the honor of being designated as a World Health Organization Collaborating Center, as a WHO Collaborating Center for Non-Communicable Diseases Prevention and Control. Many years ago, the ICMR selected us as an advanced center for genomics research. And in 2016, they upgraded us further to say that we are now been made an ICMR Center for Advanced Research on the whole of diabetes. And we are the only advanced research center in the country, and the only one in the private sector. All the other advanced centers are either part of the university or a medical college or ICMR institutes themselves. This is the only one outside all of these. The Education Academy provides courses, and this has been the backbone for our growth and for our productivity. So we run several courses: the Fellowship in Diabetes course, the Postdoctoral Fellowship in Diabetes, Eye Disorders, the first PG Diploma in Diabetes Education. Very recently, the Deakin DMDA course for diabetes nurse educators. The first batch has just completed, the second batch is now joining. And again, this is given from Deakin University, and this is the first diabetes nurse educators course in the country. We also run pan-India courses, and I'm sure the people from the Public Health Foundation of India are here, and many of you in the audience are part of the faculty for this very famous course called as the Certificate Course in Evidence-Based